was that those in higher quality jobs were able to work from home, had flexibility, could be free from the risk of contracting COVID.
Welcome to Series 2 of the Future Health Podcast, a podcast on the way we work, the work we do, and how technology will influence the future of work in New South Wales Health in the healthcare industry. We have an incredible lineup of guests this series, and we're looking forward to sharing it with you soon. Feel free to like, share, and subscribe so you don't miss a thing. Our guest today is Dr. Arif Jetha. He's a scientist at the Institute of Work and Health and assistant professor at the University of Toronto's Dalla, Lana School of Public Health. Arif is a leader in life course differences in employment of people with disabilities and the intersections between work environment and health. I'm really interested to know how we could do this better in the future. Good morning, everyone. Our guest today is Dr. Arif Jetha, who's dialing in from Toronto, Canada. Thanks for joining us today. We are here to talk about the future of work, the workplace, and the worker. And I know you've done a lot of work in this space, and it'd be great to if you could introduce yourself and get us started. Thank you.
Yeah, so I'm a scientist at the Toronto-based Institute for Work and Health, and we're a not-for-profit academic research organization. And we're arm's length to the University of Toronto. And over the last 25 years, our organization has led research on the intersection between work and health. And so that includes how health affects one's ability to stay employed and find employment, but also looks at how the work environment can shape a person's health.
That's must be an interesting space to be working in, and also challenging because things that you confronted with. I was just reading around your thesis and your doctorate and the interesting work you've done around disability and work. Would you like to expand a bit more and also bring in the lens of how COVID has impacted that disparity at the workplace? Because I know that it has surely occurred during lockdowns.
Yeah, so a lot of my research is focused on the entry into the labor market of young adults living with different disabling health conditions. And the types of conditions that I tend to look at are those that are episodic, as well as those that are invisible to others. So episodic meaning that symptoms can fluctuate on a daily or weekly basis. And sometimes someone might be free of symptoms, other times the person might be very limited. And obviously that creates significant challenges in the work environment, because one day you're totally fine and free from barriers, and the next day you're struggling. And it's particularly challenging for young people people just assume all young people are healthy and they should be able to lift the same number of boxes as other young people. They should have the same level of energy as others. But in a lot of cases, many of the young people that we've studied, under the surface, they're struggling quite a bit. They're dealing with pain, depression, anxiety, and obviously that can create massive challenges as you're entering and trying to advance within the working world. And then in terms of COVID, obviously COVID has really brought to light, especially in North America, the importance of the quality of your work and how that can really impact your health and your ability to maintain work during an economic shock. And so in Canada, what was apparent was that those in higher quality jobs were able to work from home, had flexibility, could be free from the risk of contracting COVID. Whereas those who were working in kind of like lower skilled jobs, essential workers, obviously those people were still expected to go to work. And that created significant challenges for many people, especially those with disabilities. I focus a lot of my attention on people with rheumatic conditions, so autoimmune conditions. And so if you have an autoimmune condition and you're expected to go to work, obviously that's going to create a significant level of fear in terms of sustaining employment. And so we've seen a lot of young people with these types of conditions decide that it's not right for them to be at work right now. And if you don't have that flexibility, then your only decision is to leave the labor market.
Yeah, and this is the same group that would potentially be immunosuppressed, and the impact of COVID on them is it's to choose between life or work. That's a very challenging situation to be in. Can you just elaborate more on how do you see this impacting now? We've been fortunate enough not to get a lot of COVID in our communities, and yet we've seen during the lockdowns the harshest impact of COVID has been on those lower quality employed workers where they cannot work from home, or also even on our female companions at work, because they're the ones usually ending up staying at home with their kids. So how do you see this playing out, and how through those lockdowns, and if in North America or overseas, how this experience has been coming back into work?
Yeah, so it's interesting that you say that, because I think a lot of this disparity that you're referring to isn't unique to a post-COVID world. I think the labor market is always been polarized, and there's always been a level of disparity, and that disparity has been growing quite a bit over the last few decades. And I think there's a lot of economics research to show that there's been a wage stagnation. At the same time, productivity has increased, and job quality is kind of turning two different poles, whereas those with high education, high job opportunities are able to kind of advance within their careers, whereas those who may have more disadvantages starting work, they kind of enter the exact opposite career pathway. And so this level of disparity always existed, and I think COVID-19 definitely shone a light on it, and it made a lot of people realize that there's a significant proportion of workers that are have little flexibility. They have little control over their situation. They might have little legislative protection, no access to sick leave. And this became a point of contention in North America. And I don't study these topics to that extent with regards to COVID, but I think just as an expert in work and health, to me, like it's never been more apparent, this connection between your work environment and how it shapes your health. And I think it's really important as we move forward in a new normal, whatever that may be, that we really need to focus on how to improve people's work environments so that they're not as precarious. And if there is another economic shock, people are resilient to those shocks.
And again, sorry to put you on the spot there, but I'm just wondering, in that hypothetical space, it's almost like you pointed out, there's two directions we could take, where it could continue on and the disparity increase. But are there things you think that could be done to actually bring that closer? So have you seen in places or visited places where this has been achieved in a much more and bringing the gap closer?
I think, to me, COVID-19 in an ideal scenario should get us talking about or trying to answer that specific question. Like, how do we move forward in a world where people are working precariously, where people feel like they have little control over their working situation, where essential workers are perhaps working unsafely, but without the types of protections that would enable them to continue to work or be able to stay at home if they are sick or feeling like they are exposed to COVID-19 or any other sort of illness. Now, I think a lot of the labor protections in many states and many provinces have not been developed to address this new world of work. They haven't been implemented to address gig work. They haven't been implemented to address a natural disaster or climate change or a pandemic. And so I think, to me, I don't have a specific answer. I think I could probably provide like insights, but I think this is something that we need to study a little bit more. I think for me, we really need to be creative about different policy levers that we utilize to improve the health and well-being of the working population. And I think this is a conversation that researchers need to engage with policymakers in a collaborative way. And that's something actually we do at the Institute for Work and Health, is we work quite collaboratively with policymakers to produce research that's policy relevant. And it's something that we take quite a bit of pride in, because what we find is that by including policymakers and other stakeholders early on in the research process, we produce findings that are relevant and then more likely to be applied to a real world setting.
Yeah, and I totally agree with you. And that's how what we call is translational research out here in the healthcare setting, is that if you don't include your stakeholders in the initial planning of it, you find it's very hard to get them to ingest the findings that you provide them. One of the key, and again, because these are more very abstract topics, but one of the things that I've thought about recently is around the over specialization of our workforce and what COVID extracted out of, where a lot of these, especially in medical practice, where in countries where the orthopedics doctor has had to start working in the ER because there's no surgery happening. They have to focus in and bringing it back to that basic key set of skills that you really need. And also the translation of workforce. You've seen a lot of industries pivot from making alcohol to hand sanitizers or textiles to masks. And you've seen workforce shifting over as well. Do you see now that it looks like COVID is here to stay and the impact on this labor market, which is not possibly just a single shock, but it's going to have a long-term change in direction. Do you see that having an impact on how we train our people into the future?
Yeah, and so this is actually a discourse that was occurring prior to COVID-19, which is just building skills or upskilling people for the future of work. And I think there's kind of several schools of thought on this topic. Obviously, prior to the pandemic, a big concern was the automation of work and the growing application of artificial intelligence to the working environment and what that would mean for workers. And I don't think COVID-19 has actually changed that discourse that much, because I think what came from those discussions was that workers really need to think about two kind of buckets of skill sets. The first are those like hard technical skills, the professional skills, the ability to work alongside machines, the ability to perform professional duties. But then it was also the soft skills, the ability to collaborate, the ability to be creative, to show empathy at work. And I really think those soft skills really shone during the COVID-19 pandemic, because those who are flexible, who are willing to collaborate and think about creative ways to solve challenging problems, that's kind of where this innovation occurred. And that's why this innovation occurred so rapidly, is because it wasn't just a bunch of really technically savvy people who were able to implement these solutions. It was that plus the people who are willing to work together in a crisis to solve these problems, to make sure that we had PPE, to make sure that policies were implemented in a way that could protect people from a COVID-19 transmission. So the skills of the future, I think, is something that we are continuing to grow. But again, I think what's important to note is that in our like polarized work environment or our social fabric, building skills for the future is not, it's kind of like a privileged concept. Not all of us have that capacity to gain skills of the future. And I think that's something that we're trying to really unpack a little bit more, is because, I have like multiple university degrees. I feel like I have this like capacity and this like bandwidth to think about things in a different way and to read books and collaborate with my colleagues. But there's a big subset of the population who don't have that opportunity, and as a result, perhaps they're kind of more likely to be stuck in lower quality work, or not able to build up those skills in a way that will allow them to compete for jobs in the future. And I think this is an important priority for many policymakers and educators and employers.
Yeah, and the good thing, you raised some couple of good points there. And the good thing about getting to speak about the future is that you can dream up anything you like and challenge things in the present world. And I sometimes wonder that the whole premise of you can understand schools, but the whole premise of you going into university, getting a graduation and being set for life with that set of skills. Yes, we've slowly moved into that ongoing education piece. It tends to challenge whether it's a lifelong learning piece and it's about skills rather than certificates that should really matter. And how do you fill those gaps as you grow, rather than actually, and giving opportunities for everyone through workplace. So it's not a set post that you're meeting.
No, I think I think about this quite a bit, and I actually just delivered a talk this morning to a group of educators on this topic. And I think one of the key points that I really pointed out to these individuals was that there's a study that was recently conducted by economists at MIT, and what they were looking at was occupations that existed now. And they looked back, and what they found was that like a significant proportion of the types of occupations that we have now didn't exist 50 years ago or 40 years ago, right? And obviously that's related to technological advancement, but it's also related to like these like in-person jobs that didn't exist 40 years ago, like being like a blogger or being a sommelier. Like they didn't exist 40 years ago as formal occupations. And I think to me, what that shows is that if we think like 10 years from now, most of the occupations that are going to exist haven't even like been there, they don't exist. And so that creates an opportunity. And from a policy perspective, I think we need to think about ways in which we can equip people with the training so that it has a nice foundation, and then they can build off that foundation as they move forward. But to gain those skills, I think employers play an important role. I think employers need to lead the upskilling of workers. I think we need to make sure that there are those opportunities available to all workers. And so, as you mentioned, I do a lot of research on people with disabilities, but currently a lot of the future skills development isn't necessarily tailored to the diverse needs of those with disabilities. And I think to me, that's an important gap, because there's a lot of Canadians who live with a disability. And I think another stat or another kind of point I like to really think about is the fact that in 30 years from now, they're expecting widespread labor shortages. So how do we engage the vulnerable groups of our population who tend to be excluded? And can we provide them with training and opportunities so that they can take advantage of these new jobs that haven't been created as of yet?
That's a very interesting thing you said. And, one of the, just taking on that point, and that way of training them rather can't be sending them back into uni for 3 years or 4 years, because a lot of these people can't afford to, because it's either or. We need to have these blended ways of training as well. Have you seen it happen somewhere, or have you seen examples where you could highlight to us and say, oh yeah, look, this is where
so I think I maybe without like naming specific companies, I think there's a big push in a lot of major corporations to I think a lot of CEOs and executives are seeing that, things are changing so rapidly. And if we don't prepare workers 5 years or 10 years from now, they're not going to have the skill sets to be able to do the type of work that we need them to do. So I think a lot of people are seeing that. So there's a lot of case studies of major corporations who are incentivizing workers to take on new skills training. And I think on the flip side of it, I think a lot of workers are seeing that they're not meeting the job postings, or they're not meeting the requirements of a lot of the new jobs. And so some of them are being forced to keep up with the times. But I do personally think that employers play an important role in upskilling their workers, because it's an important mechanism to kind of keep people excited about work and to keep them engaged in work. And I think in the past there was this discourse that millennials will leave work, they're not devoted to their jobs, they want to move from one job to the next. And I don't believe that. I just think that in this kind of climate where work is more precarious, a lot of young workers are truly looking for stability. They're looking for the opportunity to get a pension. They're looking for health benefits. They're looking for just feeling like they're not going to lose their contract next week and they can't find work and they're going to have to go back in the labor market or into the job search again. And I think employers can really use that to their advantage by training workers, providing them with skills to meet the demands, and then also use a little bit of foresight. What are things going to look like 10 or 15 years from now? And how can we train our employees now so that 10 or 15 years from now, we'll be a competitive work environment where we'll have the skills that other workplaces don't. And I think these are strategies that employers can really use to their advantage.
Oh, that's really helpful. Now, just a couple of other really abstract topics. One of them is, which is potentially happening, as had happened from the edge of time, is when someone with a disability, it's almost the choices you have to make about your career are so much narrower than what you actually do, and they impact that on your choice of work you do. Do you see technology, AI broadening that choices for these people? Let's talking about the people who do have that choice and do want to take on training, because I know that a lot of these people might not have that choice either.
The reason why I would challenge it is that I think when we think about contemporary definitions of disability, especially the World Health Organization's definition, it's the intersection between a person, their health, and the environment, right? And so if we can create inclusive work environments, hypothetically speaking, a person should be able to participate in a job the way that a person without a disability is able to, right? And recently, the United Nations passed the Convention for the Rights of Persons with Disabilities, and Canada has enacted legislation that has followed through with their commitment to that United Nations Convention. And what we're striving towards in our country is an environment where it's free from barriers to participation in the work environment, so that if a person is trained and is motivated to work in that specific job, hopefully, or in an ideal scenario, they shouldn't face the environmental barriers that would limit their participation in the labor market. Now, obviously, that's kind of like an idealistic perspective, because we know that a lot of work environments aren't accommodating, and a lot of people don't understand the opportunities or avenues to accommodate workers with diverse different types of disabilities. But you had talked about the role of technology, and in my eyes, technology is a really important equalizer. It might be the avenue to achieving greater levels of accessibility in our working world. And I think about so many different examples in which technology can be utilized to improve the working lives of people with disabilities. And I think COVID-19 has definitely highlighted that, with the work from home capacity, or the ability to work from home through the use of digital technologies and virtual teleconferencing solutions. Now, I think another thing that it's important to note is that a lot of young people that we talk to, they're actually like almost in some ways really excited and happy, but on the other hand, they lament at the fact that in the past they were denied these exact same accommodations that everyone's getting access to right now. So to me, COVID-19 has provided a roadmap for employers. Like, you know, if you can do it in the face of this situation, like creatively speaking, you should be able to apply it to all different types of situations that can emerge. And I think to me, that's an important lesson that we can take away from this pandemic.
Yeah, now look, I honestly, I believe the whole term disability focuses on something that we're not able to do. And if you actually had a ability-focused society and a more of an outcomes-based, you would potentially look at how to enhance ability rather than actually defining and excluding people with disability. Because there's this assumption when you say disability, or a different gender or a different race, is that there is a difference between the outputs of those two groups. When you actually just look at ability, then you go, okay, how can I bring this person to a different ability structure?
Yeah, and it's interesting you say that, because like everyone has needs, right? Like parents have needs, you might have elder care responsibilities, you might have healthcare responsibilities, you might have volunteer responsibilities. There's all different types of needs that workers have, right? And by providing an inclusive environment at work, it doesn't just help people with disabilities, it helps all people. And we've seen this in our research. Everyone benefits from an inclusive work environment. Everyone is more productive as a result of that.
Yeah, and you bring people in for what they bring into this job, rather than expecting everyone to do the same job. That's where successful work environments are. You highlighted before the fact about AI and technology improving that space, but we also talked about how it can increase that gap. Have you seen that happening? And do you any thoughts on how to mitigate that? We definitely find that in telehealth, we do find that once you increase the care for certain communities, it can actually put them worse off as well.
Yeah, so I guess there's a couple like routes to that discussion. And so the first maybe we can focus on is the application of AI within the working environment. So the use of AI and machine learning to perform job tasks, right? And so obviously the ability to use intelligent systems to perform job tasks in the current work environment, it can replace a lot of repetitive tasks and low skill tasks, right? So right away, that there's a chance that some people might lose their working opportunities as a result of the application of these technologies. So that's kind of the one discourse. The other one is the fact that as machine learning advances, there's some individuals that believe that more professional and complex jobs that require more prediction could now be replaced by computerized systems. Okay, and so now you have like accountants or lawyers being automated and being replaced by computerized systems. So what does that mean for a vulnerable worker or someone who's already faced disadvantages at work? So all of a sudden the types of jobs that maybe would provide an entry point into the labor market, now those are being replaced by machines. And then on the other hand, you have more competitive jobs, or sorry, more like professional jobs that are becoming more competitive to get, right? And so that's another issue, right? Because the professional jobs are more demanding and more challenging to get your hands on as a result. Now, what does that mean for a vulnerable worker? Well, one, they might lose out on job opportunities altogether and be forced to, not work. The other kind of avenue is that they could end up working in these really low-skilled, low-paying, unpredictable jobs that are unsafe and more strenuous and cannot be automated at this point of time, right? And so that's kind of like that kind of adds that polarization in the labor market when you have the application of AI in that manner. Yeah, so in terms of unconscious bias in AI and how it might impact people with disabilities, one of the kind of key themes that we're seeing in the research quite a bit is this idea of HR, like human resource managers, using AI systems to screen resumes, to assist with the job selection process, and then to performance manage. Now, I think on the one hand, perhaps utilizing an AI system could kind of even the playing field and provide, make decisions based on like a set of objective measures rather than subjective perceptions of a person on a hiring committee or a manager who's making sure people are working at the same level. Now, obviously, when you program these systems, a lot of biases get introduced to that, right? And so who is creating these HR management systems? And how do we make sure that they're created in a way that's equitable? And so what that will mean for someone with a disability is that, one of the biggest issues for someone with a disability is to whether or not they want to talk about their illness, right? So whether or not they want to disclose their illness during the interview process and whether or not they want to talk about it with their managers after they've gotten a job. For a lot of people, I think the recommendation is you shouldn't discuss your disability until after you've gotten your job, because it often is a big red flag for hiring committees, right? And it's sad that that's the case, but it is for many people with disabilities. But if you have a system that's set up that can look for keywords in your resume or can look at behaviors during an interview, it might be that the automated system might actually end up identifying someone with depression or someone with anxiety or someone who has an underlying health condition without that person choosing to disclose or not. Mm-hmm. And so obviously this creates this environment where the systems aren't maybe being applied in an equitable way. And I think this is something that we need to think about a little bit more as we start deploying these artificial intelligent human resource management systems. The same goes for performance management. You could have a worker who is hooked up to some sort of AI device that tracks their progress through a specific task. But what if they're someone with a physical disability that just does the task somewhat different or requires a little bit of support to do that task? Will they be penalized by this AI system? And I think that's a question that we need to ask ourselves, like, again, the equity behind the application of these systems.
No, that's a really, I totally agree with you, because I've always believed it should be performance enhancement rather than performance management. So you are trying to help, you're just trying to continuously improve someone's work rather than actually trying to meet a benchmark or managing someone to get a benchmark. And it all goes back to the design and implementation of these systems, because it's interesting how, just like any other tool in the past, these new tools could be used to either discriminate or enhance performance.
Yeah. But I think the application of AI at work can be seen as a great equalizer. And in many cases, it can actually be utilized to help make workplaces more accessible, right? So you can think about in a manufacturing setting, you could have a smart robot doing a lot of the physical tasks and then have the human worker doing the cognitive tasks, right? And so that's important. And I think going back to this idea of emotional intelligence, at this point, you can't utilize a machine system to perform tasks like empathy or collaboration. And so someone with a disability who has a lived experience and I think they can provide unique experiences to the working world because a lot of their lived experience can't be replicated by a machine at this point in time.
Oh, that's totally agree. And it's about saying what are the gaps we can use these technologies to actually help us make a better workplace for ourselves and everyone around us. Lastly, I'd like to ask you this. I mean, this is a perennial challenge for us in healthcare around that intersection between social determinants and healthcare. And time and again we try. It goes back to most of the conversation we've had today around AI and those algorithms as well, of inclusion of those fractures and how we can improve. And how do we do this better across looking at work, healthcare, and the social determinants of a person? Do you see this changing into the future as data and data systems evolve, where it's actually readily available? And again, it's the potential of misuse is always there.
Yeah, so I think obviously this is a very complex question to ask. And I think I see, again, I'm going to go back to the COVID-19 pandemic, and I see the COVID-19 pandemic truly highlighting to just a general population what the social determinants are, the social determinants of health are, and how they play out in a real life setting, right? Like we've seen those who are living in low income settings getting less access to vaccines, working in poorer quality jobs, and having fewer policy supports to help them sustain employment and stay COVID free during the pandemic. And so I think because of that, I'm hoping that as people think about policy development and as people vote for policy leaders, they kind of bring this framework into who they bring into power and who they're electing to make decisions. Now, I also think that in terms of healthcare, what I'm seeing in Canada, especially, which I'm pretty happy to see, is we're seeing a lot of physicians advocate for better workplace practices and better safety at work, and the equitable provision of PPE. And I think to me that's really amazing that we have now healthcare professionals also advocating for the social determinants of health. Because I think pre-pandemic, you might have some really savvy physicians who understand, like they see it in their patients. The ones who are working in low quality work are likely sicker, or they have greater incidences of chronic disease or disability. But there's no denying it now. Like it's just everywhere. It's in our face that where you work is going to dictate your health, and that's going to provide a pathway to all other health outcomes. And I think to me, I think that this is the one of the biggest revelations that the general population has obtained from COVID-19.
Yeah, and I think the evolution of digitization and data science itself has broken those barriers. We keep talking about breaking down the silos within organizations, but it has actually broken down barriers within people's lives. The intersection between work and home environments and health and social factors, and they are all merging into the future.
Well, just to add to that, but I think there's a role that researchers and health scientists can really play in advocating for the measurement and collection of data in ways that are going to enable evidence-based policymaking and to inform research and policy on the social determinants of health. So we need to make sure that we're collecting the right types of data, and we have the right types of data. And I don't know if that's always happening in all cases. And I think that's also, Sean, been pretty apparent during the COVID-19 pandemic, is in certain cases, there was an absence of data that was required to help inform policy. So I think, again, that kind of goes to your point about even though data is available, is it good data, and is it allowing us to answer the questions that we really need to answer?
And are we using it ethically? Now, look, thank you so much, Arif. And, we could go on and talk about this for another few hours. And hopefully someday we can have you in person down under, or we can catch up with you in Canada someday. Thank you so much.
Yeah, anytime you want to come to Toronto, you're always welcome.
Yes.
See ya. Bye.
So that's all we have time for this episode. Thanks for joining me on the show. If you enjoyed the podcast, make sure to like, share, and subscribe on whatever platform you are on right now.